For you guys that don't know Sally, she is a world-leading expert on oxalates, all things oxalates. So I imagine the focus of our talk will be on that. So what I'm going to do, Sally, is I'll just kind of get through some basic questions I think most people will ask. And then what we'll do is I'll look through the chat and ask any questions that come up as the best I can. And then we can answer them if you don't mind. And usually this runs about an hour. Is that okay for you?
Yes, I've planned an hour for you guys.
Thank you so
always
much.
good to hang out with fellow nutrition geeks who can't get enough.
Yeah, and it's wonderful to have you. You're a great resource for a lot of people. So just for people that don't know, oxalates are something that is generally found in food, mostly in plant foods. We make a small amount of it. We don't really have much really use for it. Can you describe just in general, maybe the top 5 signs, or if you have a few more, of oxalate toxicity or oxalate problems for people that don't know they might be dealing with oxalate issues?
Well, it's an interesting question, identifying this. If it was really super easy to identify, we would know about this disease. And the fact that it's so tricky to identify is one of the reasons why you've never heard of oxalate toxicity, that you can actually have a toxic condition in your body because you've overwhelmed your body's ability to handle and excrete the amount that you're either creating or exposed to through your diet. And it's one thing that's helpful to know about oxalate is that there's a real variability in how much your body can tolerate. If you have a history of digestive problems, your absorption rate is probably super high, and you may be absorbing 2, 3, 4 times, 5 times more than someone whose gut is really healthy and happy. And if you've had a long history of a heavy vegetable diet, a lot of beans with the lectins and all the other plant toxins, that damage increases your absorption. So that just brings up the central symptom that tends to go with this syndrome, that there tends to be digestive problems that are both a vulnerability piece and also a end result of oxalate toxicity. So usually there's gut issues. Often there's pain issues, energy issues, brain function issues, and neurological issues. Those are the big triad with oxalate, the traditional triad that was known and prescribed or proclaimed, the triad that would be the diagnostic triad in the 1850s up through the early 1900s was digestive problems with either rheumatic problems or neurological problems or both. And people don't realize neurological problems include mood, like flat affect, like you just don't feel enthusiastic about your life or your moment or your goals. It's hard to get through life. Some people get into severe depression. Others get into periodic anxiety attacks, and you see that more with the oxalate clearing, I think, than you see it on the other end. But we don't have good data because people aren't studying this problem. So what else? Aches and pains, stuff that doesn't get better, things that come and go mysteriously, that kind of just like show up and go away, and then they show up again. And a lot of people with oxalate problems, it's the thing that nobody can solve. You go to your doctor and they say, well, you're just malingering. And then you go to all the holistic people and they are sure they can help you. And it seems to help for a while and then it doesn't. And that's sort of the classic pattern. If you've got fatigue, pains, arthritis, headaches, mental, like cognition issues, and the gut stuff, you could be looking at an oxalate problem. And some people, part of their problem comes not just from the gut absorption, but from their kidneys' ability to get rid of it. And if you've had a history of kidney stones, then it's possible that your ability to get rid of oxalate is compromised. And it's surprising how many people have compromised kidneys and don't realize it. We think kidneys are like extra. You can give one away. We think of kidneys as kind of like, oh, no big deal. But kidney disease has been the fastest rising disease over the last 40 years. It's been the disease that doesn't have a icon or just doesn't get, it's not a popular area of the body to think about, but kidney problems are very common. And if you never see cloudy urine, which is often, if you don't have an infection, cloudy urine could be a sign of something we call crystalluria, which is too many crystals in the urine that now is refracting light and you're seeing a cloudy, non-clear urine. If you can produce that urine, that's a pretty good sign that your kidneys are sort of working pretty well. If you don't produce that urine, you may be in trouble. If you've been eating foods that are high in oxalate, you will occasionally see that cloudy urine. But if you don't, that could mean that you're also having a problem on the excretion end. And so too much absorbed, too much or not enough leaving the body, and you get this serious accumulation that occurs chronically over years and years and eventually breaks through as all kinds of health problems.
Hey, so I just back on the gut type question, there's a question from one of our members, Masa, who is actually my co-founder. So she's asking a question about, does gut bacteria have any role in the breakdown of oxalates within the gut? And then if you've had those wiped out due to antibiotic use, is it possible to restore that through perhaps things like fermented foods and things like that? Is there a role for gut bacteria and oxalate disposal?
There is a role for gut bacteria, but you have to remember that gut bacteria belong in the colon, not in the small intestine or the stomach. And absorption of oxalate begins in the mouth, in the stomach, and the small intestine. So you're going to still, regardless of your bacteria in your colon, you're still going to see absorption of oxalate from the diet. It doesn't necessarily prevent absorption. But what it is probably doing for us in the colon, the right bacteria is a handful of lactobacillus, and the big famous one is Oxalobacter formigenes. That one is kind of rare in the modern colon. Something like 70% of us don't have it. It's very susceptible to at least 8 of the major popular antibiotics. So in the colon, what happens in the colon has an ability to excrete oxalate. And those I'm a little bit terrible with my words today. Can I confess a problem with you guys? Just let's get clear. My neighbor next door, a bachelor in his early 80s, just died this morning.
Oh no, sorry to hear that.
The ambulance showed up. They found a not alive man there. I've had to witness with the police about how to get in touch with the family and all that. So I think that's interfering with my brain. So just give me a little break today, okay?
Well, of course,
it just happened. And it's not coronavirus. I'm sure of that. I'm probably a heart attack. A not very fit man, unfortunately, but a beautiful person. So we're sad to have him go. Anyway, so we're back to the bacteria in the colon, and the colon's function to help keep you well is an excretion function that apparently is turned on and off. Like it's not happening all the time, but when the kidneys are overloaded and or there's some metabolic acidosis going on, it turns on these excretors in the colon. Also, it's probably likely that in hepatic circulation, now you guys, I don't know about your anatomy, but how well you know anatomy. Hepatic circulation is the vascular system that drains all the things you absorb from your food in your gut. And that includes bacteria and all kinds of creepy stuff that you put in your mouth or gets into you. And so it all goes straight to the liver for cleansing and processing and holding on to nutrients. And that hepatic circulation is really important. And in that hepatic circulation, there's a potential to immediately then try to kick out the new oxalate that's coming in from your spinach smoothie. Some of it might be able to be kicked out right away. So the trafficking of oxalate, some of it potentially is just going from your small intestine into your hepatic circulation, possibly back around right away through the colon excretion route. But that's all science that's yet to be understood. And of course, all these functionalities depend on the context and the person's own health and so on. So the colon excretion is excreting into the colon so that bacteria can then consume it and destroy it for you. If you don't have that bacteria, you need another binder in the colon to help the body do this excretion route. So when we're concerned about oxalates in the body, we often encourage the use of calcium supplements without vitamin D, and use calcium supplements so that we can make sure that there's calcium in the colon to act as that binder to carry the oxalate out, because most of us are not having enough of the right bacteria, which are not easily restored. The other part of that question was, how do we get that bacteria back? And there's been studies and attempts to generate products for the last 30 years for a probiotic that can achieve this, and it hasn't happened yet. Not an easy thing to do.
All right, this is because obviously many of the people in this chat are on a carnivorous diet. Many of them no longer eat oxalates. Some of them come from a background, many of them come from a background of a ketogenic diet, which can be very, very much high in oxalates with the spinaches and the almond flours and the dark chocolates and all the things like that. So here's just a general question, somebody talking about that they came from that sort of background, and now they find themselves struggling with itchy patches from time to time. Is it possible that's an oxalate dump? And then I guess a more general question to this, how long, do we see like a rapid reduction in overall body oxalate capacity over a short period of time and then kind of a gradual tapering over a longer period of time? How does it usually play out when you no longer eat oxalates?
Okay, so most of us have been on a fairly high oxalate diet because we either grew up on peanut butter and whole wheat bread, or we love potato chips, or we love dark chocolate, or we happen to like something weird like buckwheat. Like everybody's got their thing in their history where they've probably been eating oxalate on a day-to-day basis, and probably so frequently that you've got accumulations in your body. The body does not want to be storing all this oxalate. It's doing it to save you. It's pulling it deliberately out of your bloodstream to save your heart and your kidneys, and assuming you're going to get over whatever you're eating, and as soon as you stop eating this dumb thing full of oxalate, it can release it when your kidneys are able to do it, and when it's not going to disturb the vascular system and put you in arrhythmia, because there's a lot of electrolyte disturbances that happen when oxalate ions are flying around. So you've got this accumulation, you suddenly stop eating it, and you change all these receptors that are controlling this careful program of keeping you alive so you don't end up in a heart attack or kidney failure from the oxalates in your diet. This is a big deal. Like how fast you turn around this ship of moving from someone who's sequestering oxalate to someone who's now releasing oxalate. And that transition is what you're asking about. Like, okay, so we've been sequestering and gathering oxalate for years, and now you're suddenly no oxalate coming in from the diet on a carnivore diet, and a lot better nutrients. You got such good bioavailability with meat. The nutrients empower the body's vitality for doing this difficult housekeeping. The oxalate, you can think of oxalate almost like radioactive junk hanging around once you break it back down, or you can think of it as a Superfund site underneath an old gas station. So there's these old tanks underground, these little crystals that are often wrapped up in old DNA and dead white blood cells, therefore kept quasi-inert in terms of the local cells. So you wrap it up like you would insulate a live wire so that it's not causing a lot of problems locally. But when you start digging up that old junk, you break it down into these nanocrystals, which have the same toxicity as asbestos crystals, and ions, which are also very toxic. These things depolarize membranes and destroy mitochondria and cause a lot of cell distress and oxidative stress, and bring in the immune system. So oftentimes when you're digging out these old Superfund sites, you get these immune system reactions, which can include funky rashes. And I have pictures. If anyone wants to see pictures of what dumping looks like, we can show those if you're interested.
Yeah, those are always interesting to see, with the skin. I've seen some of the flecks coming out the skin. Just here's a couple of questions I'll roll into one. People are asking about, obviously calcium oxalates are number one type of kidney stone. And somebody's asking about, why or do we see a higher incidence of kidney stones occurring when people as they go through this oxalate dumping? Do we see more of those? Is there any similarities in the way we deal with those in uric acid stones? And then about, I know you talk about potassium citrate and some other things. What is a way to sort of deal with it? And that's lamenting the fact that she went carnivore, felt good, and then started developing what she thinks are signs of oxalate dumping, and now has to add plants back, and she's running into all these craving issues again. And so I know there's things in there. Maybe you could comment on that in general.
Oh gosh, there's so many issues in that, like the craving issues and so on. All this toxicity of the oxalate literally affects the enzymes that run your energy system. So your mitochondrial enzymes, when there's oxalate present, can only work at about a third to half of their normal rate. And oxalate are known to cause permanent mitochondrial damage. And you can get into a chronic state of problems with your energy metabolism. And I think this is partly what's feeding this difficulty with this carbohydrate intolerance, and a little bit of carbs and you're like immediately craving it again. Or you get, some people can't stay zero carb, like myself, because we can't produce enough muscle glycogen, because we have so much sort of fibromyalgia type damage in the muscles that our ability to produce muscle glycogen just doesn't recover immediately. And the reason why this carries on for so long is because it takes about 10 years for your tissues to clean this stuff out. And you continually are picking up new little Superfund sites all over your body over many years. In the first several years, I mean, it can be 3 years of very difficult, serious symptoms that can make you miserable because there's a lot of neurotoxicity. So your mental ability to cope with this is usually compromised, like your ability to give yourself a pep talk and your ability to just carry on, your ability to cope is not as good when your brain is toxic. And so you can get into states of anxiety, and it aggravates the other symptoms because it's really how you're managing it mentally that's going to affect the quality of your day. You know, if you're just freaking out or discouraged, this emotional difficulty is part of the symptom pattern of the problem. So anyway, I'm going off in that one area because I think that's so important for people to understand. If you start getting into not feeling good on carnivore, very good chance, excellent chance that this is oxalates tormenting you, like your oxalates from the past. And, you know, I work with people who are really sick. I am one of them. I'm at 6 1/3 years on low oxalate eating, and almost a year of when I tried full carnivore, which started April 1st last year. And I really felt that was important because the carnivore world has done a beautiful thing. You guys have basically revealed this oxalate problem in ways that you couldn't see before. It's not till you really go off oxalate and stay off them for a while that you start to see this mayhem that's going on in our physiology. It's amazing. So what's our real question, Sean? What are we trying to talk about?
Well, no, I mean, you know, I guess there was a question about, I know you talk about different ways to help, you know, with.
Oh yeah, the remedies with the kidney.
Citric. Well, potassium citric.
Yeah. The citric acid is shown over and over and over again to be a great way to turn these crystals. They may be invisibly small, but they're like little chips of quartz hanging around in your tendons and your bones and your saliva glands, wherever they want to be, they can be. What is it? 75% of us have, or more, 78% of us have oxalate crystals in our thyroid glands. If we're over 50, it's almost guaranteed you've got oxalate. And if you've ever tried to live a healthy life, you've probably loaded up with something with oxalate. So it's there. And these crystals are very hard and difficult to break down. The cells have to get these lysosomes that can really generate a lot of acid to help break them up. But if citrate's around, that's a huge helper because citrate attaches to the calcium. It's a chelator of calcium on those crystals. And it changes the strength of the bonds in the crystal and transforms a little chip of quartz into something that's more like chalk. And makes it much easier for them to break up safely. So you can literally dissolve out kidney stones using lemon juice. And that's about a half a cup a day. Or the synthetic citric acid is in these citrate supplements, which is calcium citrate. We love the calcium because of the binding of the oxalate. Magnesium citrate, similar. People usually need to balance them in order to control their bowel function, whether they tend to constipation or diarrhea would affect their choice of which type and how much and what ratio they use. And then the potassium citrate, I find is incredibly helpful because that's the #1 therapy for kidney stones, in case people don't realize it. That's the first script that should be written to prevent the next kidney stones is potassium citrate. And also because this breaking up of crystals and moving them out, every time they're moving around, they're causing cell distress. The cells swell and leak, and they leak out potassium. And that's your muscles and your bones losing potassium. And that's part of the whole osteoporosis picture too. It's not just the calcium. This perpetual loss of potassium is huge. And I see people who are in T-wave inversions in the emergency room with like no electrolytes left because they went on 2 years of almond bread. And now their system is kicking it out because they went carnivore, and they're really chronically sick with an electrolyte problem that's hard to correct. So the potassium citrate can be really helpful if you tend to have trigger point knots in your muscles. That could be a sign that you've basically got calcium stuck inside muscles where the potassium is supposed to be, and you're so desperate for potassium, you get these trigger points that we see in fibromyalgia. You also get this muscle damage of fibromyalgia that's kind of quasi-permanent and takes a while for that to come away. There's something else I want to say about all that, but we'll probably stumble on it again.
Yeah, that's okay. So there's a whole bunch of questions here, so I'm going to try to do my best to get some of these answered. One thing about the mitochondria, like I said, you can say permanent mitochondria damage. We do have capacity to regenerate and build new mitochondria as time goes by. So it's not like you can't get out of this situation.
No, but you have to be patient because it's 10 years of clearing, so you're constantly aggravating your cells. It's really hard to build mitochondria when you're giving a mitochondrial poison every day because you're clearing your old spinach salads and your old almond bread and your chocolate habit and your peanut butter thing or your secret potato chip habit. Those are all haunting you.
This is a question that I know, we've all seen probably the acute oxalate toxicity with regard to renal function. Marcel is asking, what can a high dose of oxalate acutely do to people? And I know maybe you can talk outside of the kidney function. We're all aware of these papers where people go into renal failure from oxalate, overload. But are there other things, like if you just hammer in a bunch of almond flour or whatever, is there an acute oxalate thing that might show up that would be interesting?
Well, some people notice immediately where they'll get nausea or something like that. In a high dose oxalate poisoning, it's often a GI symptom. So you might get gastric reflux or GERD or feelings like you got a SIBO attack kind of thing, or you might get sudden diarrhea or constipation or, lose rectal function, all kinds of stuff up and down the alimentary canal is possible there because there's a direct toxicity going on right there. In the earliest study, it was a major experimental style study published in 1823. It was really interesting using animals. And what he found was the more concentrated, less dilute, like if you put oxalate powder kind of level concentration in the gut, you wouldn't see the systemic poisoning as much. It couldn't move around as much if it wasn't dilute and dissolved. So it sort of depends on its bioavailability. When it's concentrated and directly touching these mucosal membranes, you'll get direct physical burning, direct physical assault and damage to the mucosal lining. But with the more dilute or continuous, you get more systemic problems. But I would say people can get neurological issues. They could suddenly brain fog suddenly comes on, or they suddenly get an anxiety attack, or they suddenly have to get jumpy bladder where they run into the bathroom. So I would say those are the major ones, is like neurological, urological, and GI.
Okay, here's another question talking about, is there a timing issue, or if so, with menstrual cycles, is there some sort of oxalate dumping phenomenon that occurs in rhythm with a women's monthly cycle?
This is a really fun topic because it's about two different things. It's about our circadian rhythms and it's about our hormonal rhythms, which obviously are very closely allied with each other. And the hormonal rhythms are big, how circadian rhythms are managed, in addition to like sun and sleep patterns. We haven't, obviously nobody's really studying this issue because medicine's in denial that there's extrarenal oxalate problems and that this oxalosis is going on for people without renal failure. Like in the medical literature, they think this is only happening post-renal failure. It's a product of renal failure, which is not true. I have great kidneys. They've been peeing out clouds of urine almost every day for like 30 years. It's amazing because I have something that is working well, and that is when your system's high in oxalate, it turns on the stuff in the kidneys. This is regulating the genes in the kidneys to make all these proteins that prevent the oxalate from clunking together. chunking up, growing into crystals. You produce all these proteins, and that prevents kidney stones. So my renal function is good in terms of the signaling can turn that on and off. But back to circadian rhythms. It's really interesting. One study, just one poor guy did a 24-hour urine collection every day for 30 days. And when they mapped that out on a graph, it was a perfect bell curve. The classic bell curve, which you guys aren't into science, it's a hill. You go up the hill and down the hill in this nice smooth line. So across the whole month, the amount of oxalate coming out of his kidneys was in this perfect month cycle. Well, that's what a menstrual cycle is. It's a monthly cycle. But that was a man. So there are daily cycles. You're going to see patterns across the day. A lot of people, they'll get their symptoms a certain time of day. And that was well established, but ignored anyway, and published about by Claude Solomons, who tested women's urine, or almost 4,000 women he tested. And he did individual voids instead of this all day in one pot thing that we normally do in clinical medicine. We do this 24-hour urine. But what he was doing was every void of the day he was testing them, and he did each woman for at least 3 non-consecutive days. And what he found is that they had spikes, either 1, 2, or 3, typically 2 spikes out of, say, maybe they do 9 voids a day or something. 2 or 3 of them were really out of the ballpark, like 10, 15 times what they should be. That's the disease. That's the hyperoxaluria. But you can't see it when you do the 24-hour urine collection. So that's another example of a circadian rhythm. So we have day rhythms, we have the month rhythm, and I'm sure there's an annual rhythm too going on with how the body is really doing a lot to manage oxalate. It knows about oxalate because it's a normal metabolic byproduct. So it's equipped for managing oxalate levels and doing what it needs to do for all its layers of function that's still mysterious to us. It's sort of beyond our research techniques and even our ability to understand it. So yes, there's a circadian rhythm. Yes, hormones affect this, and I don't have a clue how and why.
All right, good answer. So you don't know, that's good to say. Hey, somebody's asking about, can oxalate affect or cause or lead to vertigo? Is there any evidence?
Oh yeah,
okay.
I think it does. Yeah, it's another one of those, because this all the senses, your smell, your eyes, your taste, your ears, are all areas of the body that are prone to oxalate accumulation. And your nerve system, your nerve that run the senses, are also very sensitive to oxalate. So in combination, you get tinnitus, vertigo, all kinds of stuff. And of course, when the gut is unhappy, that's a major center for the nerves as well. They call that the second brain. And if the gut's being poisoned, that's another neurological assault. You often also see it with the vagus nerve and the diaphragm, and you get also things like hiccuping and coughing and chest symptoms, as well as these other senses. And it's part of the neurological side of the neurotoxicity, as well as direct assault on the function of the receptors that allow you to hear, see, and taste.
Here's a question about tapering oxalate. Are there any sort of foods you'd recommend, maybe low carb foods, that are better than others for doing an oxalate taper?
Yeah, let's see. There, a low carb one might be something like artichoke hearts. Let's see. A lot of them are like carrots and parsnips, which are pretty sugary. What are some of the other ones? We'll have to come back to that. I have to think about that one.
Okay.
It's when you start looking at the plant kingdom to help you from your plant kingdom problem, it's sort of difficult. But the taper is important, and some people have to do it by just picking the food you don't want to give up. Like most people, the chocolate's the last to go, or their cup of tea, or their potatoes. Those are the major addictive foods are tea, potatoes, and chocolate.
There's a couple questions about oxalate-induced rashes. Is there a prototypical looking rash, like where it's located, how it looks? Is there a way to kind of distinguish an oxalate rash from, say, another type of rash? Is there kind of?
You want to see the pictures? Should we look at pictures? I could screen share.
Yeah, if everybody's okay, yeah, sure.
Let's see if we try that.
Yeah.
That might be.
Hopefully they'll let us do that. I think it should. There's a screen share button somewhere in here.
Let's see. I might have to turn this on to, do you
That's
guys
fine.
see
Yeah,
anything?
because some people are asking about bumps and scales, and is there, like I said, is
I'm
there?
trying to find where my mouse went. Oh, I know what's wrong. I have my monitor set up wrong. Shoot. Oh, here we go. All right. Can you guys, are you still seeing me?
I do. Where are you? At least on my screen, I do.
Seeing me. So, oops. All right. So let me end the show and just switch
Is
this.
that you there in the picture, or is that, I don't know.
What picture do you see?
The one that click that title with a neck. It looks like a neck.
Oh, you can see that. Okay. So
Yeah.
if I put it on, can you see that now?
Absolutely.
You
Yeah.
can.
Yeah.
Okay. So yeah, that's this one in the middle. Can you all see? This is a backside. This is the spine bones here.
Okay. Yeah, I got you.
This is my back in 2009 when I first went low oxalate because I had an attack of vulva pain. And I
Okay.
never connected this with the diet, but it was the most bizarre thing. I don't get rashes. I don't know if you can see it. It did not itch, thank God. But it was so weird that I took a picture of it. And then when I did it more knowing what I was doing in 2013, I got this thing on the clavicle area, the chest, and on my face. And that rash left behind melatonin scars on my face. So I have these sort of odd shaped sort of age spots on my face that were secondary to this rash. So you can tell that something was getting pushed forward if it's bringing out the pigment forward. And then these are eye styes. This is a really big area for glands around the eyes. There's so many different glands supporting the eyeballs. They're so coolly designed. And this area is a very common place to see oxalate releasing. And it didn't work for me to go to the eye doctor and get the treatment. And he told me to put hot potatoes on my eye. The thing that works for this is coconut oil. It works great. It helps to dissolve the sebum that's getting stuck there and pull that oxalate out. And it's antiviral and antibacterial. So it basically solves all the problems of the stuck glands and the infection that's occurring. It's very easy and doesn't hurt you to put some in your eyeballs. Perfectly safe. So here's a different kind of skin reaction where the skin is peeling off the fingers. Y'all can see this, right? This person was the first case years ago when someone said, there's crystals coming out of my body. Could that be happening? I'm like, I don't know, I guess. It's like, what? This is all new to me. So this is way back. She was getting crystals coming out of her nail beds, and all of her fingers were peeling for like a year. For 6 months, she had to wear cotton gloves all the time. She was trying to work full time as a nurse instructor, and this was going crazy. Now, she had a history of frostbite, and oxalates are where you've had old injury. So if you've got old injuries or areas of your body that's complaining more than others, that's the characteristic place to have rashes, peeling, weird stuff going on. It's not a part of the body, it's just your personal history of where you've got tissue that couldn't defend itself when you were eating all that high oxalate food, and that's where it got stuck. And the lower one are my feet. Now, this is a scar from my foot surgery. I had bilateral foot surgery back when I was supposed to be in college, but I was off being a patient in wheelchairs and on painkillers. And my feet have been peeling on and off now for 6 years, but really I got a little toe pain, and then this peeling is I'm still cleaning out my joints, but my feet are awesome. They could do whatever they darn well want now, which is a miracle. This is what really drove me crazy. Like, how could it be that I spent a decade using crutches and wheelchairs and spent 3 decades with feet that didn't work, and all of a sudden they're fine because I quit eating sweet potatoes? I just could not believe that. So here's a different kind of rash that some people see. This is a flare-up of eczema, and you've seen this one on my Instagram. This is one of my Instagram followers shared us with all of us. And these are what came out of her rash. This is what she was calling eczema and an eczema flare-up. Can you see the little clear quartzy looking crystals? Now, we don't have a lab that's willing to analyze these crystals, and they don't stay good for long. Eventually, you leave them sitting around, they kind of turn brown, and you have to look at these fresh. This is another example of some rashes on one person and crystals coming out of the neck here, just below his ear by the jawline. And he had some of this he had salivary gland symptoms way before he started the carnivore diet. And he had actually started his sort of healthy diet in his 20s, eating whole wheat bread and going to the health food store, and then on spiritual quests where he was leading himself to vegetarian eating. And he had osteoporosis by the time he was in his 30s. And unfortunately, that poor bone quality crushed when he was in a mountain bike, and he crushed his cervical spine. So he's got a lot of neck issues right now, but he has all kinds of things going on. This is really common to get this swelling. I have a vegan, same thing. His feet suddenly, had no symptoms for a year and a half. And then he got really bad foot swelling to the point he had to go to the doctor. And they're like, well, we got to send you to rheumatologist because you need something special here. And that lasts like 2 weeks. And then he went another 6 months with no symptoms. And then that swelling came back again. This is really common where you get the joint swelling kind of thing going on. And this brown urine is another kind of dumping symptom that is like some kind of major detox. The urine can be incredibly smelly and weird. You can get weird body odor and go through these kind of orange to brown to just thick and bizarre urine. It's a detox. It's probably pulling out infection and all kinds of other junk. Here's the foot swelling on that other guy again. Red patches on the top of his foot, big hot swollen ankle kind of thing. And then there's another one where her rash, this one you've all seen on Instagram if you're following me there. This is another person who shared through that connection. She developed this rash all over her lower legs, and each of these little corpuscles here pushed out a chunk of quartz like that. And then she had this iceberg the size of that close to a penny. You can see how huge these crystals are. The body's literally pushing them out. Now, another skin sign can be these little tiny faint bumps all over the skin that look like little proto-warts. Like, oh my gosh, you're getting a bloom of warts coming along. This is actually my hand. I've had this problem for like 25 years. I've been trying to use wart treatment on it, which never ever worked. I was never convinced it wasn't warts, but it wasn't warts. And really what I think it is deposits of crystals, as you see here, and this is a oxalosis case from the rheumatology literature. But I think what's here, I've never had crystals pushing out of my body. I think what's left here is fibrosis, and that eventually that'll go away because a lot of scar tissue gradually goes away on a low oxalate diet. So this is probably scar tissue from oxalate deposits here on the skin here in the hand. So those are my pictures of skin stuff. Was that helpful?
Yeah, no, it's very helpful. Thank you for doing that, Sally. Let me see if you can maybe go back to the unscreen share, and then I can see what other questions are up for people here.
Okay.
Goodness. All right. A lot of people are commenting that those are great pictures and that some people have similar rashes. So let me just kind of find where I left off at. Yeah, there's a lot of comments. So let's see if I can find, sorry.
No problem. I'm sure we all need to digest the pictures, and I can keep them entertained by continuing to talk about this purging, because there's a term that Susan Owens came up with the dumping. And I think of dumping as like this oxalate clearing gone mad, where there's too many tissues already. They're not taking turns. You know, it's like too many people trying to get in the stadium or out of it at the same time, and it's not good. But the oxalate clearing can go on at levels that are so subtle that you have no idea is going on. And hopefully you're going to see clearing you're just going to have days where you're kind of in a bad mood, you're a little grumpy, you're tired, you got a little shoulder pain, or your hip's a little funky, and that can just be, you think of it as normal, like ups and downs of life, but that's the typical oxalate clearing. And often you can get confirmation if you have some severe fatigue where you just got to have a nap or you're just useless. And then you see some cloudy urine the next day or that evening. That's confirmation that your symptoms were related to the oxalates. And I actually have a client, he gets cloudy urine first for 3 or 4 days, and then he gets 3 or 4 days of misery afterwards. Mostly I see it symptoms, then urine, or back and forth, you get it on and off. And unfortunately, some of us can be in this purging mode, this oxalate clearing illness, like a lot of the time. Like you go for 3 days and you get an hour break. You go for 2 weeks and you get a day break. You know, it's like, can be kind of chronic.
And here's just a question to that extent, talking about interstitial cystitis, which is, irritation of the bladder. Does the fluids help? Is it drinking a lot of water? Is that going to help to mitigate some of those symptoms or cause it to get better quicker?
Well, yeah, that's a tricky one because some people get immediate relief. And if you're a lucky person, anytime you slip up and go back on oxalates, like have a cup of tea at your mom's house, you will run to the bathroom that evening and you ruin your night's sleep because your bladder's turned back on again. I consider that lucky because your body's able to tell you, no tea for you. With the interstitial cystitis, generally the diet is just amazingly helpful, but the pelvic area is the area of focus with this problem because the body is expelling primarily through the pelvis, and you see it in the urinary tract and you see it in the GI tract, so it can affect the function of both. If you get a sense of heaviness in the pelvis or any kind of weirdness in there, it's probably oxalate related, and you may end up with an attack of irritable bladder that can be pretty hard to live with. But generally, I say use the calcium citrate. That works really well with a lot of these pelvic symptoms. Time it before you're likely to get your symptoms, an hour or two ahead of time, especially. So if you tend to have nighttime interstitial attacks, take it at bedtime. And if you wake up in the middle of the night, take another dose of like about 250 milligram tablets. And that can help.
Yeah, and to that point, there's a couple people asking about megadosing vitamin C and dosing. Can you give us a quick little dosing regimen that's not crazy and safe? And I know these people are going to be eating 50 million units of whatever, and they go off on that stuff. So
yeah, right. Because I just did a post on Instagram, so and it's on Facebook, so you can find it on Facebook and on Instagram, and it links to shows you a few studies that suggest that how quickly you can get into trouble. Like taking one study looked at 8 grams. This is an excellent researcher. This is a 40-year-old study from 1980. This is the woman who figured out the Oxalobacter formigenes and how she figured out all that gut transfer of she's brilliant. And she did this study 40 years ago that showed that 8 grams of C within 10 days and you're in oxalate accumulation mode. It's really fascinating. So I say that 100 milligrams a day is plenty, but 200 milligrams is for sure going to saturate your immune system cells with vitamin C. If you go over about 250, you're pretty much going to be in a situation where you're risking higher oxalate in the body. So 250 would be my upper limit for, especially if you're going to do it every single day, all the time, that you're going to get into too much oxalate if you go over 250. If you need vitamin C because you're sick, then you need vitamin C as chemotherapy. You want to take this chemotherapy, it's usually done as IV, because you can get hydrogen peroxide to knock out pathogens or even cancer cells, but that's a whole nother kind of medical deal. But you don't want to be doing medical level megadoses that's going to wreck your kidneys every day just in case you could get sick. It's not a good approach. So 250 or less. I take about 30 milligrams a day on a pretty carnivore diet with an occasional bit of pineapple in it.
All right, somebody's talking about peanut butter wrecking them, and they're glad you pointed that out because they noticed that.
Interesting.
Do you find that oxalates can sometimes mimic gout-like symptoms? I know you kind of addressed on that, but there's a
yeah, absolutely. And I did a post about gout and the fact that the idea that gout is just uric acid is not even scientific truth. It's just medical laziness. We just didn't want to bother talking about all the other gouts, including oxalate gout. Absolutely, toe pain and joint pain. They used to call it the oxalate gout. It's just been dropped. Yeah.
Okay, somebody's asking about, again, fasting, say alternate day fasting. Is it okay to sort of taper, I guess, assuming tapering oxalates on every other day in that sort of regimen, sort of to combine fasting with an oxalate taper?
Yeah, that's a really good question. And again, I can only use what you might call clinical judgment just based on working with people. I don't have big, fancy statistics where we've been really careful about determining this. But my sense of it is that I know from the literature that it takes about 5 days for the cells to put together the equipment to start doing the clearing. Like the cells have to metabolically change. They have to get new transporters on their membranes and make more liposomes and do all this work. And that's about a 5-day process. So there's often when you first go on the diet, you get a minimum of a 5-day honeymoon where you go down to 0 or low oxalate diet, and in any direction you can do it with or without carnivore. Carnivore is kind of the extreme way to do it because carnivore is so nourishing because you're also got 0 oxalate fast and you've got all those nutrients, which promotes that cell vitality, which then promotes that clearing, which can be too much. So generally, I have had people tell me that they regret fasting because they really believe that fasting promoted excessive oxalate clearance that made them really sick with electrolyte problems and anxiety attacks. So my people mostly, I think, would say, cool your jets on the excessive fasting. Don't try to get too many A+ in all of these things. Don't try to be the best carnivore you can be or the best faster you can be. You want to listen to your body. You want to think about what your body really needs and be able to adjust to what's going to work and be okay. Otherwise, literally, you can get so sick with this oxalate clearing that you could ruin your career.
All right, somebody's talking about injuries, and like, we have these joint injuries. Do oxalates, can they preferentially take up residence in old injury sites to further exacerbate, problems with those things?
Absolutely. That's really where oxalates are known to accumulate as the site of injury. That's actually how it works in the kidneys. How you get a kidney stone is the oxalate injures the cells, and then that injured area is where the oxalate gets stuck. The cells that are injured can't defend themselves. They don't have a good system for glutathione and doing all the things they need to do. They're just kind of hanging out there as kind of dead proteins and glycoproteins, and that is very sticky to oxalate. So you're going to get those injured or dead cells are like magnets for oxalate. And then you have the regenerating cells that are trying to repair. New regenerating cells have a lot of these glycos on them. They have a lot of sugars on them because they use the sugars that hang off the protein on the outside of the cell are used like sticky feet to walk around, because a new cell migrates into its proper final place to live its adult life, to do its cell thing that it does. And so those regenerating cells are really prone to oxalate accumulation. So it's not just the injury, it's the attempt to recover from that injury where you're going to see oxalate accumulation. Hence, things like my foot surgery wasn't very successful because I was eating Swiss chard and high oxalate foods pre-post surgery, and then the rest of my life I never gave it a break. So that's why 30 years later my old injured feet are still clearing out, but they're really functionally awesome. Hopefully that explained it.
I think it does. Somebody were asking, is there a treatment for an oxalate-induced rash? Is there a thing, eat topicals, or what's the best way to treat if you have an oxalate rash?
Yeah, it's interesting because luckily some of us don't get the itch, and other people are driven crazy and have skin issues for like 6 months of torture. And unfortunately, the antihistamines often don't work, but I would start with that anyway to see if a topical with a little antihistamine in it helps or not. And if it doesn't, then it's not a histamine-based reaction, but often it can be. In general, you tend to get higher histamine levels in the body with oxalate dumping because it triggers mast cell degranulation. Ice might help with the rash, a cold cloth, put a wet cloth in a baggie in your meat drawer or freezer and treat it with cool. Baths might help. You can take I like to do a 5-salt bath that's Epsom salts, potassium, bicarbonate, sea salt, little baking soda, things like that in there. And that might help. But honestly, it's not always stoppable. It's kind of crazy. I don't always know of a good answer other than know that your body is healing and it's not going to last forever. I think that's the main thing. It's not really a serious problem like you need a diagnosis. It's just a part of the healing process, and being able to calm down might actually help the pain. Meditating can sometimes help pain. Sometimes exercise makes it worse, sometimes better. You have to play around and see what's going to work.
Yeah, there's a couple more questions on interstitial cystitis. Some people talking about what's the best way to control pain. Do things like alcohol, carbs, other medications, blood sugar control, do they have an impact on the symptoms?
Yeah, again, I don't have like research. And the problem too, one thing that people have a hard time getting their heads around is the fact that every case is unique. And I'm not talking about my personal experience, because that's also true in my personal experience, but in the literature, the medical literature keeps marveling at what we call clinical heterogeneity. Every case, we see this in the cases of the genetic disorder, because there is a very rare genetic disease where people fill up with oxalate because their metabolism is damaged. They're where the enzymes are in the mitochondria versus the cell in the wrong place. They don't work right, and they're generating tons of oxalate internally. In those cases, every single one is totally unique. It is amazing. Some people fall apart, their bones fall into mush, and they die a very painful last several years of being propped up in a wheelchair. Others have nothing in their bones when they're die. I mean, it's just amazing how different the physiology is in each person, even though it's the same disease. So it's hard to make giant generalizations, because it's really about you.
There does seem to be, I mean, it seems like you say there seems to be some commonality with urinary symptoms. It seems to be a prominent feature for most people. Is that fair to say, or is that?
Yeah, if not all the time, you'll get a period of time when it is an issue. And a lot of it is, frequent urination, or the feeling like you got to pee and you really don't, that kind of thing.
Yeah, and one of the problems is, a lot of the symptoms mimic other conditions, and so a lot of people have joint pain that's not necessarily oxalate or depression and so on and so forth. But so it's just kind of an interesting way. And you say there's not really a good way to assess it, other than maybe if you were to sort of track your urine and look at urine oxalate levels throughout the day. If you could measure that, that's challenging, to say the least.
Yeah, there's not a lot of good objective tests. I mean, people can be on their deathbed from oxalate poisoning and have none in their plasma.
Let me ask you, somebody had asked about oxalate, either toxicity or, detoxification or dumping, and cardiac palpitations. I know you talked about electrolyte. Is there, or cardiac, palpitations, arrhythmias, is there a relationship with oxalates? It sounds like there might be.
Oh, most definitely. You see that a lot. Yeah, all the toxicology studies show that, because what's going on is you get this electrolyte disturbance. You got potassium in the wrong places. You got calcium in the wrong places. The heart really requires the right electrolyte balance in the blood to function well. And so it doesn't take too much disturbance where the heart gets a little confused. Yeah.
Yeah, and so is there, outside of, obviously tapering, not eating a lot of oxalates, coming off that stuff, the various citrate, calcium and citrate things, any other electrolyte things we have to be concerned of, sodium, potassium, magnesium, things?
Yeah, I think mineral deficiency is a major marker of this disease, and I think you should be playing around with salt. I think salt can help the delivery of potassium and so on. And an occasional spike of insulin can help that. When insulin is up, the cells are more receptive to potassium. So, there may be times when you can't be zero carnivore, that it might actually help your symptoms. It might calm down the feeling of stress and anxiety. If you did have some carbohydrates in the diet, there may be room for that kind of thing, but partially because it helps the body manage this electrolyte balance and start to restore proper levels of potassium in the muscles and bones.
Yeah, I know when I talked to you in Connecticut, you were talking about, you were having some issues with cramping and found that adding a little bit of carbohydrate, I think in the form of maybe even fructose was helpful for you with cramping. I assume that's an electrolyte issue. I don't know how directly it was related to oxalates or just generally being on a carnivore diet in general.
Well, I really think oxalates are causing fibromyalgia-like damage in the muscles and definitely causing energy management issues and mitochondrial function. So I am sort of the fibromyalgia and joint pain style of oxalate damage. And so for me, like I look really fit and muscular. I have really pretty well-developed muscles. I think they're so well-developed because they don't work that well. Like I got extra fibers in there because they're damaged. Like they hurt a lot. They still hurt. Like when I do exercise, I have quite a bit of intense pain still in the deltoids and so on. It's just torture. And I believe that that's going to clear up over time, but it's still there.
Sally, just a general, somebody's asking you about your personal diet. Could you describe what you're doing currently with your diet, just out of curiosity?
Why do you think they want to know this? What is the deal with that? I'm happy to tell them, but what are you going to do with that information? Like, it's unique to each of us what we need to do. I am eating a lot of beef. For years, I've been an advocate of local agriculture. I was the first medical school to get a grant, an ag grant. I got a Southern Sarah grant in 2004 to interview a bunch of local farmers who do nice grass-based operations and about all their different kind of animals they handle and what they do to their field and what they do with the animals, and so that consumers could access this. And so I've been advocating meat, and especially buying local meat where you know about how it's raised and whether it's clean and so on, for a long time. And so I always have a half a cow in my freezer and a pig. I eat a lot of pork and a lot of beef. Pork and pork fat, pork skin, and a little bit high in these amino acids that are the pork skin that can become oxalate in the body, but it makes me feel good. Pork fat and pork gives me a mood boost. So we eat at least a big pork shoulder once a week. I eat warmed up, beautiful hamburger. Sometimes I fry all the way to cooked hamburger. I do ribeye roast, the kind of prime rib now and then. And I eat mostly beef and pork. And then I add in, when I need carbs, I add in some pineapple, some papaya. Occasionally I'll make a white rice when I really need a carb boost, and that is soaked rice that's soaked with bentonite clay to reduce the arsenic in the rice, and soaked for 24 hours minimum to reduce the phytates in the rice. And then it's cooked with coconut milk and a little ginger for flavor and salt. And that occasionally we'll do that. But literally, I had to give up my lemons. I used to do like 5 lemons a day. But when I went full carnivore on April 1st last year, I saw a reduction in this kind of aging inflammation skin that I get around my neck and chin area that makes me look old. And I realized I probably am reacting to something in the lemons that's adding to my inflammation. So I quit the lemons. But I used to be before carnivore, I ate basically coconut stuff, lemons, and meat. Because my digestive system really kicked me out of the vegetable thing. I was really a vegetable maniac, and after I went low oxalate, I could hear what my body was saying, and I moved further and further away from vegetables and had already kind of kicked them to the curb. But some people can handle the vegetables and can have salads and things, but I don't do that.
Sally, thank you. It's been an hour. I appreciate your generosity, your time. I know I can just tell from the comments, everybody really enjoyed this. We'll put this up on YouTube, so we'll get some more view. And hopefully more people will be aware of this condition, at least to think about it as an option. Not everybody that has knee pain has oxalate dumping, but it's still something, when you kind of run out of ideas, it's something to think about. And maybe we should think about it a little earlier. And thanks for doing what you do. Hopefully this carnivore movement will continue to make people more aware of that, and hopefully a lot of other things. I think we're sort of changing a little bit our perceptions on nutrition, and appreciate everybody in the community that's kind of coming together and challenging sort of the standard doctrine that may not be in the best interest of everybody involved. So thanks again, Sal.
Well, likewise, Sean, it's really good work that you're doing, pulling together this community. And I'm just so impressed with everyone who's willing to go full carnivore. Like, what makes you so brave? Because the culture is so opposite of that. And it's really cool. So I find you all very inspiring. So keep it up.
Thanks a bunch. All right, guys, I'm going to end the meeting and we'll be back again tomorrow. And, thank you guys. Everybody, I think, is doing a good job. Sally, have a great, summer coming up. Hopefully this coronavirus stuff will pass pretty soon and we can get back to somewhat normalcy in life. I just want to announce to everybody that I just heard from Belinda Leonards and David Ludwig that the Harvard study has just passed through IRB. Start collecting data, and so I will announce that on social media. Hopefully we'll get 20,000 of you guys are filling it out and getting this study done. So hey, keep I'll let you know soon. So anyway, guys, take care.